Hello and welcome to Aesthetically Speaking. Today I'm going to be chatting to Dr. Nicole Kanaris, an experienced doctor who specializes in aesthetic medicine. She is an international speaker, an international trainer, an author, an artist, and an award-winning doctor. And today's topic will be looking at the fact that there is no one-size-fits-all in aesthetic medicine, whether it's regarding filler or toxin or certain procedures like laser therapy or even skin peels. With our diversity in South Africa, it's going to follow that different skin types are going to use different modalities. So stay with me. Let's go and find out. Thank you so much for joining me on Aesthetically Speaking, Dr. Nicole, or rather Dr. Kanaris. As I said in my introduction, we're going to talk about the diversity that we have in our country regarding aesthetics. And you recently participated in a 6-part international roundtable series which focused on this diversity. And it's really important to us to know that doctors have to be cognizant of the similarities or the differences in anatomy, as well as the treatment preferences of our African patients. Can you tell me about this series?
Thanks so much for having me on. I'm excited to be here. So basically, Dr. Sabrina Fabi and Dr. Steven Dayan from the States put together a roundtable discussing different countries and different ethnicities and how they're treated. And I did the South African or African perspective, and we discussed how African skin, morphology and anatomy of the face differed and what treatments should be taken on by these patients. Also the psychology behind it, because we know that over the years in aesthetic medicine, it was always based on the white patient, yes, the white female patient. Yes. The ideal for a patient was always set on the white ideals. So now we have to look at Asian patients, African patients. There's a whole host of different mixes even coming into it. So it's very important when you're doing that as well, not to just say this is the ideal for an African patient and expect that that patient's going to be happy with their African ideal. They might want a more westernized feature, more Asian features. So it needs to be a discussion. We can most definitely say this is what we found, this is what we see, but the discussion with the patient on what do you prefer? What do you want to look like? What do you identify with? It goes to say, I'm sure you've seen women with a cleft, and then you think, you know what, we always learned that's a masculinizing feature. Take away a cleft. But that might be something that ties the person to their father and their father's family, and they want
that feature.
That feature.
All right. How has this study then impacted your practice regarding treating your African patients?
Well, I think because we're on social media and we presented on this and we showed that, a lot of the patients did see that, and then they would come for advice on what do you think needs to be done? Mm-hmm. So it's giving advice, advising the patients, and then once again taking a step back and discussing a treatment plan with them on their preferences. It did change quite substantially because what we thought, for instance, biostimulators, you're stimulating collagen formation. In African patients, there's more fibroblasts that are tightly packed. So the results will be faster, maybe more intense. So there's a lot of things you need to consider. Post-inflammatory hyperpigmentation and treatments with cannulas, large bore cannulas, and causing scarring on patients. So things need to be taken into account. And it did open my eyes, up to thinking, wow, we need to think a lot more broadly.
Again about
exactly
how to go about it. Well, before you go into those issues, the most significant feature, obviously, then that distinguishes patients from different races is manifested in skin color. So what you were touching on just now is what are the differences, say, in aging between a Caucasian skin like mine and an African skin? take us through that collagen content, the increased resistance to sun damage, or just what are the differences, the major differences? Obviously, we can chat all day.
Yes.
But
So firstly, photoprotective. Melanin is photoprotective. So the darker your skin, the more protection you have from sun. Not to say don't wear sunscreen, but there is that protection. And so the aging of the skin is a lot later. But they are prone to pigmentation from damaging the skin. So there's a lot more inflammation in the skin. Okay, fibroblasts are more closely packed, so skin is thicker.
which is good.
Which is great, but heavier. So you don't get, so there may be sagginess, but you don't see the crepiness that you'd see in like a very white skin.
Yeah.
Okay. There are some distinguishing features, but as we know in South Africa, there's multiple different ethnicities.
Yes. So
The features change according to that, like the level of the brow, temporal hollowing, scleral show. So how much of the white of the eye showing? That's quite common as African patients age. The distance from here to here becomes bigger. So the need for filling, volume depletion in this area.
In fact, one of the questions I wanted to ask is the volume loss in African skin. Is it different then? Are they different, or rather, is it in different places?
So
you get the volume loss.
So the aging occurs so much later. It's in the 6th and 7th decade, after 50 and 60, that you're starting to see aging of the skin. And then only then are you starting to see deflation. And generally it's around the eyes. We would say a receded chin initially. That's bony structure. But that bony structure is normal anatomy. So then you need to consider, is it a true deficiency in the jaw, or is it structural? And are patients okay with that and happy to have a little bit of less activity in the jaw? It's less prominence. But then with aging, they get submental fullness. So you might have deflation here in the eyes, but then the fullness under the chin because you don't have that extension of the chin.
Right. So then in your practice, say, and you have the African patient coming in, what is the main treatment that they want?
So it's so interesting because our African patients, when they walk in the door, most of them are wanting skin health and they come for pigmentation issues. So they will literally come here and they want IVs, drips to make their skin healthier, brighter. We don't do skin lightening procedures, but we do believe in skin health. And then they will want to do peels and look after the quality of their skin. And this is because, as I said, we're on social media. So a lot of the patients that are coming in are younger. So they don't have that need for deflation yet, for tacking up the face and putting structures back where you want them to be. Yeah. It's more for how can we make you look the best that you can look? And they want beautiful glowing skin, our patients. So those are the things that we address. The second thing is that they do have a bit of orbital, the tear troughs. They complain of tear troughs. They may complain of a lower brow. So those are the things we're addressing at a younger age. And if they're noticing a deficiency in the chin. But main reasons for them coming here are skin health, pigmentation, maybe previous acne scarring that's caused a bit of post-inflammatory hyperpigmentation, and then around the eye area, something to be done there. Later on in life, we're revolumizing areas that have lost it. Temples, cheeks, although the distance here is wide, so you've got to be careful not to make it even wider. And then a lot of jawline work just to improve the jaw structure. I'm sure you probably think, African patients have the most beautiful lips, and they do. Okay, now that's all the trend, having big, beautiful lips. Yeah. But they come with gorgeous lips, and yet they want more definition, more hydration. And then as you age, they're not going to be protected against not aging in the lips. So they will have as well volume loss in their lips. And then we re-volumize the lips.
It's so interesting. You did mention skin peels. So There's this myth that peels aren't really safe for black skins. Tell us about the African patient benefiting from skin peels or other skin resurfacing treatments.
So I think it needs to be done in the right hands. Okay, anything aggressive too fast can cause inflammation and pigmentation. So we need to know exactly what regimen you're on at home, what products you're taking, because there is a greater sensitivity and a higher risk with any darker skin tone getting inflammatory problems and causing pigmentation. So it's not to say no peels, but your skin needs to be ready for them. So the skin needs to be appropriately prepped for procedures. And in the right hands, these treatments can be done, from peels to lasers to a whole lot of other treatments, but with care. Always take a step back and go slower than what you would say, like someone from the UK with like flowery white skin.
And of course, all this contributes to a functional, healthy skin, which is what we all want.
Yes.
You have quite a few African celebrities coming into your practice. And can we name some?
I'm sure they wouldn't mind,
Yes,
because they're open to
So Pearl, Tusi, Somisi, and the other day I think I saw Chris Jafter
yes
on your Instagram. So tell us about the value of having a celebrity come through and possibly posting what they are doing on social media. Obviously, it's educational, but take us through it.
So I think in South Africa, people are so conservative. No one tells their husband what they're doing. I've had best friends around the table that all come here and they're all like, well, would you ever try putting filler? And they're all coming already. So it's such a conservative country. And we just need people, I think, with that platform to take, to say, I do this.
Yes.
You know,
and it's fine.
And it's fine.
Okay.
Started off beautiful, but I want to maintain my beauty. I want to keep my skin structure looking healthy. I want to, glow and look beautiful forever. And there's nothing wrong with that. So they do, and they're so open about it. And I'm so grateful to them for being open and posting about the fact that they do toxin, they have fillers, that they're doing vampire facials, they come for pills, they will do IVs. And they're doing all of this. It's not that they're here every day, because I know we know Madonna and Kim Kardashian have a team that follow them around and they're having treatments daily to look like that. But they do. They take how they look seriously and they want to maintain it. So part of being beautiful is having confidence and putting it out there that, you can do these things to help you along the way, sharing. Because I don't think many SA celebs actually talk about their treatments.
Yeah, so they don't. And it's important because, as I said before, it's not only educational, but we're all looking for that great, functional, healthy looking skin, which is part of aesthetics, which is part of aging beautifully.
Yes.
You don't have to look younger necessarily. It's more about being healthy and that health span that is important.
Exactly. Can I say one more thing?
Yes.
I think in today's age with social media, there's so many young people that look at their phones and they think, wow, this person looks amazing. They don't know that's a filter. Or they don't recognize that there's so much editing to that photo. So it's just so important to have confidence, to feel beautiful, and to know that a lot of it isn't real. And a lot of it is people doing things to look that way. So don't be harsh on yourself. Be kind to yourself and get an opinion from a real person, a doctor, somebody that can give you true advice, and go forth on a nice skincare journey to look healthy. Like you said, glowing, beautiful, healthy skin.
Yes, I love that. Going back to that other thing that African skins don't need sunscreen, I want to emphasize that because that is that carries on and on and on. Oh, you don't need sunscreen. Your skin's so dark and whatever. And that's even in my generation, which, there was no sunscreen.
Yes.
I'm in my 60s, so there was maybe you got a hat slapped on your head and a bit of Nivea.
And then you had olive oil to get a tan, never mind.
So thankfully, skin like mine, even though it's white, I had that Mediterranean skin and I didn't burn. However, there was that thing that if you had olivey skin, it was fine. You didn't need sunscreen. The paler girls and boys had to have something on. But that's that myth that has just carried on. Tell us about sunscreen, daily sunscreen.
Daily, not even daily. Like you got to apply Yeah, more than once a day.
But particularly in African skin.
Definitely important. Even though there is that photo protection because of the melanin, you still need sunscreen. And it was actually so funny because Dr. Nassif launched a skincare range in South Africa, and I emceed the launch. Most of the people that were at the launch were African people. And he came on, and as American as he is, he cracked this joke saying, black skin don't crack. And, you guys all think you don't need to use, sun products, skin products, because your skin is going to stay beautiful forever. But like we said before we went on this interview, people are living longer. We need our skin for longer, so that skin needs to be healthy and taken care of. It is important to use a sunscreen at least 2 to 3 times a day. We live in Africa. The sun is always out. It's always there. And even when you're indoors, we've still got lights. So it's very important to use sunscreen.
And that's men and women.
And children.
Please.
And children as well.
And before we get a barrage of messages, the skeptics saying, what are these white ladies talking about? African skins, Dr. Kanaris has studied this intensely. So in closing, I'd like to finish off by asking, what makes you excited about being in aesthetic medicine today?
Gosh, I love the innovation. It's constantly changing. And probably my most happiest moments are spent in this clinic where, doing this for 15 years now, I have patients that are my friends. I have influencers that you mentioned that are my friends. The time you spend with your patients, we're so blessed that we don't see ill patients. We see healthy patients. So our relationships with them are about their families and about their lives. And we have a lot of fun in here, just generally living it up and advising our patients on how to stay healthy and happy long term. So I really love that. I love that I can spend time with my patients. And in aesthetics, I love that there's this innovation constantly taking place. Things are changing and there's advancement.
And you make people feel better about themselves.
Happy.
You boost that confidence.
Exactly. I hope so.
I'm sure you do. And thank you so much for joining me on Aesthetically Speaking. I'm sure we can do this again.
Sure. Anytime, whenever you want.
Thank you.
Thank you.